Hello. Oh, did you see that? I just moved it up a little and it got lighter. This is Miss Janice, the natural hair care tutor. I am happy to be here this evening. We're going to get right to work. We have our 21 pages already set apart. We're going to be starting with page number 43 today, going to page number 52, 64. We're reading 21 pages. Okay, where we left off yesterday or the last time is with diseases. And one of the diseases that we learned about is the parasite. And I showed you a picture of a parasite. But what we said we're going to do this time is we're going to time ourselves, just read through, and then we're going to talk later. Okay, pathogenic bacteria. Pathogenic bacteria is a one-cell organism that causes disease and infection when entering the body. Diseases. Pathogenic bacteria. Staphylococcus is a contagious pathogenic bacteria that infects the hair follicle and can be transmitted by skin-to-skin contact and unsterilized tools and implements. The two most common types of staphylococci are furuncle and carbuncle. Furuncle and carbuncle. Look, I'm not seeing. Okay, diseases. Pathogenic bacteria. Furuncle, a pimple or boil perforated by a hair that produces constant pain. A carbuncle, an inflammation of the subcutaneous tissue similar to a furbuncle but larger. It's not bunkle, it's furuncle. It's FURUNCLE. Disorders, dermatitis. There are two scalp disorders that manifest similar inflammatory and topical conditions. Seborrheic dermatitis and psoriasis dermatitis. Disorders, dermatitis. Seborrheic dermatitis. That's spelled SEBORRHEIC. Dermatitis. It's a skin disorder or form of eczema caused by an inflammation of the sebaceous gland or an inflammatory reaction to some commonly used hair product. The scalp is red, inflamed, and itchy with white, creamy, yeast-like film or patches that coat the scalp, causing light flaking of dead skin cells, resembling wet dandruff. Disorders, dermatitis. Psoriasis dermatitis, an inflammatory condition that results from an autoimmune disease of the skin. The scalp is red and irritated and covered with patches of silver white scales. Disorders or pityriasis. Pityriasis. Pityriasis, also known as dandruff, is a microscopic fungus that feeds on the scalp's natural oils and creates byproducts that cause irritation on the scalp. There are two types of pityriasis. One is pityriasis capita simplex, and the second is pityriasis steroids. Pityriasis is spelled Pityriasis. Pityriasis. Okay, disorders, pityriasis. Pityriasis capita simplex is the first one. This is classic dandruff, it says. The scalp is itchy, dry, and flaky, resulting in scattered skin cells, which are visible flakes on the hair and shoulders. Pityriasis simplex. Disorder, pityriasis, steroids. Severe dandruff similar to seborrhea dermatitis, which is spelled Seborrhea. The scalp is red and inflamed with large, greasy, or waxy scales, which are combined with sebum, causing white, creamy patches to stick to the scalp. When the scales are when the scalp is moved, when the food with comb, bleeding or oozing of sebum may result. Disorder, alopecia. Have you heard of alopecia before? I didn't have. I'm not saying anything. Alopecia is an autoimmune disorder that mistakenly attacks the hair follicle during the anagen or telogen growth phase, which causes abnormal hair loss, balding, or reduced hair density. There are several types of alopecia depending upon the location of the head, how it evolves on the scalp, and its underlying causes. Disorder, alopecia. Alopecia totalis is just small, round patches of hair loss progressing into total scalp hair loss, or alopecia universalis. Universalis is a complete loss of body hair. Disorder, alopecia. Androgenetic alopecia. It's okay, let me spell it. Androgenetic. Androgenetic alopecia. Slow decrease in hair density with a reduced hair diameter. In men, it is generally located at the parietal front and progresses to a horseshoe-shaped outline at the crown of the head to the occipital area. In women, it is generally located at the crown of the head and at the temples. Disorders, alopecia. Alopecia areata or areata is spelled Areata. Sudden or sometimes unrecognized falling out of hair in patches or spots. These areas are usually lighter in color due to poor blood supply and will usually grow back. Disorders, alopecia, diffuse alopecia, radical and sudden hair loss of the entire scalp, followed by thinning of the hair density, which results both men and women, but primarily young females. The hair loss is temporary and the hair will grow back as long as the hair follicles remain active. Disorder, alopecia, postpartum alopecia. Temporary hair loss for 3 to 9 months after pregnancy due to sudden changes in hormone levels returning to normal within a year. Disorders, alopecia. Traction alopecia. Rapid permanent scarring or balding on the scalp due to continuous pulling of the hair too tightly over a long period of time, resulting in the hair being literally pulled out of the follicle, taking out the hair root and bulb and destroying the hair shaft. This hair loss is most apparent in the frontal and temporal regions and can also affect the nape area. Disorders, canitis, no, canit, canitis. It's spelled Canities. Canatize is a term for graying hair, which is a loss of natural pigment, more melanin in the hair. There are three forms of canatize: congenital, acquired, green hair. Acronym CAR. Congenital, acquired, green hair. Disorders: canatize. Congenital canatize due to lack of melanin in the hair which exists at or before birth and will occur in albinos and occasionally in people with normal hair. Disorders: canatize. Acquired canatize. So the first congenital, acquired, repeated. Due to the aging process during the telogen phase, excuse me, the follicle and bulb shrink, reducing the process of hair pigmentation or melanin. This may also occur permanently as a result of genetics, prolonged anxiety, illness, or diet. Disorder: canatize. It was ringed hair, salt and pepper. A variety of canatized characteristics characterized by alternating bands of gray and pigmented hair throughout the length of the hair strand. Disorders canatize. Disorders: treco no trichoptilosis. Trichoptilosis is Trichoptilosis. Trichoptilosis are split ends of the hair which start as small cracks in the cuticle that deepens into the cortex. Disorder: Trichor- trichorhexis nodosa. Trichorhexis nodosa. No, it's not even a trick. It's Tichorhexis nodosa. Tichorrhexis. Trichorhexis nodosus is knotted hair, which is a brush-like spreading out of the fibers of the broken off hair along the hair shaft. That is a dry, brittle condition that includes formation of nodular swelling along the hair shaft and breaks easily. Done. 13 minutes. Okay, diseases, pathogenic bacteria. So what I'm going to do, now that I know that it takes 13 minutes to read, when I don't add, I'm going to slowly go over this again. Diseases, pathogenic bacteria. A pathogenic bacteria is a one-celled organism that causes disease and infection when entering the body. And remember when we first got this part, I was saying that you as a natural hair care practitioner, you're not even licensed yet. Right now you can do things free. You know, can I practice on your hair? Can I tell you this? I'm learning this. Uh, I wrote these words down. Can you go over them with me so that I can even learn how to spell them? I mean, that can be something as I'm tutoring, because I'll be tutoring this to younger people, a younger age group too. And right now I'm doing the spelling of it. But I would like for you or to see you to hold up your little what's the name of those cards? They're like 3x5, like, and you write recipes on them. Can't think of the name of it. They're white. They have a red stripe across the top. Can't think of the name of it. Cue cards. Well, they're not called cue cards, but that's what we're using now. And then you let somebody Okay, how do you spell pathogenic diseases or pathogenic bacteria? And what is pathogenic bacteria? See, because it only takes, I told you, this book is really like, it might take an hour to read the whole book. Okay, so diseases, pathogenic bacteria. Staphylococcus is a contagious pathogenic bacteria that infects the hair follicle and can be transmitted by skin to skin contact and unsterilized tools and implements. The two most common types of staphylococci are, and then one is furuncle, and you remember what the other one is? Carbuncle. Diseases, pathogenic bacteria. Furuncle, a pimple or boil perforated by a hair that produces constant pain. It sounds like that would be like an ingrown hair. Anyway, carbuncle, inflammation of the subcutaneous tissue similar to a furuncle, but larger. And these are disorders. Uh-oh. Dermatitis. There are two scalp disorders that manifest similar inflammatory and topical conditions. Seborrheic dermatitis or psoriasis dermatitis. And dermatitis, I believe, is the outer layer of the skin. Inner layer. Titus? Ah. Anyway, disorder, dermatitis. Seborrheic dermatitis is a skin disorder or form of eczema caused by an inflammation of the sebaceous gland or an inflammatory reaction to some commonly used hair products. The scalp is red, inflamed, and itchy with white, creamy, yeast-like film or patches that coat the scalp, causing light flaking or dead skin cells resembling wet dandruff. Oh, please, please, before you get here, you're going to figure out a way to get to know the people's hair. You're going to figure out a way to get to know them. And I suggested on yesterday that you have a checkoff list for everybody. Okay, did we talk about this? Did we talk about that? Because right now I'm learning and I'm teaching at the same time. Even though we're one on one, I'm learning and teaching at the same time, and I don't want to miss anything. And so you want to be, and tell your clients, I want to be good at this. You know, give them a paper to fill out, not a paper, but a little questionnaire. How can I do better? How was the environment? How was the atmosphere when you came in? You're going to do it. You're going to do it, and you're going to be doing it well. Okay? Disorders, dermatitis, seborrheic dermatitis. What was the other one? You just know that sebaceous gland. I'm going to say sebaceous dermatitis. Seborrheic or psoriasis dermatitis. Where did I find that? Oh, the pathogenic bacteria. These are diseases, and these are disorders. Seborrheic dermatitis is a skin disorder or form of eczema. The scalp is red, inflamed, itchy, and white. Ooh. Ooh. Oh, did y'all get a chance to see how I make these? Okay, it's a video before this one. I did it before I put it on this morning. So there's probably gonna be a lot of oh, there's probably gonna be a lot of moving around because I had this on top of the keyboard. I am so sorry, guys. Okay. So I'm gonna go because for some reason I just keep going. But I'll be back tomorrow. So today it took not a long time. I'll relook at this one. I was gonna go over it again, but I want to see how it looks to just go through the book. How long it takes to read the 21 pages. It didn't take long at all. I don't think it took 15 minutes. But anyway, 8 minutes maybe? I'll look at the video again and tell you. But I want you all, like I said, to go with me, to flow with me, to learn this with me. I might be the first one to take the test. So far, no one has found me yet, but I'm liking it, and I think I'm gonna read the book through. So I might race these and then read the book through, look up, make faces, wink, hand signals, whatever, just to make sure that we get through the book. And then maybe the next day we'll talk about the book. And then the next day we'll talk some more about the book, like that. But I think that's what I'm going to do because it seems so quick to just read the book. Let me get out my next 21 pages. Styles and techniques. I like this part where it talks about the tools. So we just got done with 64 and 21 means 60, 60, 70, 85. Mm-hmm. Yeah, 85. Here they are. See, look. This 56 foot. Okay, well, I'm going to say toodaloo. I'll see you. Y'all have fun. Did you look at my video yet? And then it's like, I'll see y'all to not if not. Well, I'll see y'all in the next video, or I'll see you when I see you.